Hello, everyone, and welcome to today's TVR Communications webinar titled Technology, Health, Literacy, and Patient Experience. My name is Allie Libb, and I'd just like to go ahead and cover a couple of housekeeping items before we start. So just to let you know, we will be recording this webinar, which will be emailed to you after the event. And if you have questions during today's webinar, please feel free to submit them using the chat feature that's located at the bottom left of your screen. So with that, we have a great webinar in store for you. I am pleased to turn it over to Frank Forte, Chief Business Development Officer with TVR Communications, and he's going to kick things off. Frank?
Well, good morning. Thank you, Allie. First, let me just introduce the company. So TVR Communications is a healthcare information technology company dedicated to developing best-in-class interactive patient solutions and services that enhance the patient experience. Last year, we were voted by CLASS, the research organization, as best in the category for our interactive platform, PCare. So we do a lot of work in hospitals, and we do a lot of work with people like Dr. Parnell with respect to health literacy and increasing the patient experience, enhancing the patient experience, and getting patient engagement. So let me introduce Dr. Parnell, who I'm sitting here with. First, she's principal and founder of Health Literacy Partners. She also is nationally recognized in health literacy as an expert, as well as an award-winning author. She's a member of the Institute of Medicine Roundtable on Health Literacy, a fellow in the New York Academy of Medicine, and a fellow in the American Academy of Nursing. Just a few things to her credentials. I've personally worked with Dr. Parnell in the past on many projects, and I'm delighted she could join us today. Welcome, Dr. Parnell.
Thank you for having me.
So we're going to kick this right off and get into the topic of health literacy, which I think a lot of people aren't clear on what it really is. So I'm going to ask Dr. Parnell to describe what is health literacy.
Sure, and Frank, I think you're correct. I think the term health literacy is such a broad term, and many people don't have a full understanding of the context of it. There's part of that is that there's many definitions in the field, and the most common definition from the Institute of Medicine or the ACA is that it's the degree to which individuals have the capacity to obtain, process, and understand basic health information and services that they need to make appropriate health decisions. For people who have heard me speak, my concern with that definition is that the onus is often on the burden, is often on the person that's receiving the health information or health services. And in addition to that, the term appropriate, I often ask appropriate for who, the patient or the healthcare professional. So I think it's a good start, and the field has, moved now in a direction where it's more of a partnership. So it's also about not only individual skills, but also the skills of the healthcare professionals, the systems that provide, and organizations that provide the healthcare, and all of those factors. So those also influence somebody's health literacy level.
So we work with a lot of healthcare partners, and I've only can name 2 healthcare systems that actually had health literacy as a department with people in charge of that. Is that generally a recognized term?
I think now with all the initiatives that are coming, through certainly New York State, that's bringing more attention to it. The National Academy of Medicine, which was the Institute of Medicine, is now the National Academy of Medicine's Roundtable on Health Literacy, has been doing tremendous amount of work with multiple stakeholders to advance the field. And I think as we're moving more towards value-based payment, outcomes and milestones will be measured, which will impact upon revenue. So people are starting to be more aware of health literacy and the impact that it has upon individuals. The implications of low health literacy are many. The research shows that a person that has low health literacy uses less preventative services. They have less knowledge about their disease or their treatment options. There's poor health outcomes. They tend to misuse emergency room or, emergency services. They often use that as their primary care provider. There's an increase in hospitalization rates, utilization rates, therefore more costs are associated with, that care. And there's a tremendous amount, actually, of stigma and shame associated with that. So, people will say, I could tell if someone has low health literacy. But in the field, we often say you can't tell by looking. Mm-hmm. And health literacy skills are fluid. They're context related. So you may have somebody who is very well educated but is nervous or is thinking about their parents that they have to go pick up or their children. At that moment, their health literacy skills may be lower than at another time when they're not under such stress or in pain. So they're fluid. So I think it's very important that we understand that it's cross-cutting. It impacts everybody. Populations, there are certain groups that tend to have or experience, lower health literacy, and those are older adults because of the cognitive changes that we go through with vision changes and hearing changes. Racial and ethnic minorities, people who obviously are less educated and have lower literacy levels will impact upon their health literacy. And people who have less income and limited English proficient individuals all tend to, it disproportionately affects those groups, but it does impact upon everybody.
It sounds like the majority of patients coming into a health system have some degree
Yes.
of health literacy.
Yes.
Or limited degree of health literacy.
Yes, that's correct.
As a former nurse, would you say that most nurses today engage patients thinking around health literacy terms?
Well, once a nurse, always a nurse, I was going to say. But I think nurses, their tendency, when speaking with patients, certainly around patient education, try to speak in plain language and utilize principles, but there's many challenges that they're dealing with nowadays. There's higher acuity, there's increased throughput. They might not have all the resources necessarily right at their fingertips that they need. So it is a challenge, but there are things that, we can do, and I think we'll be getting into some of that, throughout this call that can, enhance that patient experience, that patient understanding of their health care.
Great. Thank you. So let's dive a little deeper. Let's talk about how health literacy impacts the patient experience.
Well, when we talk about the populations, as we alluded to, our demographics are changing and transforming very rapidly. We have much more racial and ethnic diversity. Our population is aging. There's more in the 2010 census, I believe, there was more people who identified as 65 and older than any other census. And that's going to continue to occur. In fact, there'll be many more individuals that are 85 years of age and older. So that impacts upon health literacy. And with the increase in diversity, racial diversity, we do have more limited English proficient individuals. So the ability to not proficiently speak the English language also impacts upon health literacy. If you take a person who does not speak the English language, that is going to impact their experience in a healthcare setting, whether it's an ambulatory setting or an inpatient setting. So, just the populations that we're serving now have much more diverse needs, and we need to be able to provide that person-centered care so that we enhance that patient experience, and we provide effective communication so that there's follow-through in what we're hopefully partnering with them and asking them to do.
I mean, it sounds like it goes beyond patient experience and is more about patient safety.
It is. It all ties into patient safety, patient outcomes, and all of the milestones that we measure. It's the right thing to do. Back in the 70s, I think we did a very good job of it. We weren't dealing with all the changes that we're dealing with now, technology and, a decreased length of stay. So I think, and the other thing to think about, just think of all the people now, all the individuals that have health insurance, which is a wonderful thing, and a wonderful outcome of the Affordable Care Act. But what are we doing for the people that are newly insured about educating them how to use that insurance? So just think, I often don't understand everything, with our health insurance, the terms. Think of somebody who has health insurance for the first time and trying to access and navigate care. Understand what's a deductible, what's a copay.
I don't even understand.
That's what I'm saying. So, it's cross-cutting, but imagine doing that for the very first time, not even understanding what preventative care is. So people have this card, they have technically the ability to access care, but don't know about that and don't understand the terms. So, I think that's something that we really need to work on as a nation, and really start educating people about the terms so that they can take advantage of that health insurance.
And that's just in normal everyday settings, but now it's compounded by, you're not well, you're in a hospital environment, high anxiety, that must compound the situation. How do you even talk about patient experience if you don't understand what you're doing or reading or in there for, or what you're...
We're not going to have a positive patient experience. And ultimately it's about safety and outcomes. But we'd like to develop relationships and engage with patients and their families. So that experience is an important part of it. It also, people will feel more likely to ask questions, to be an active participant in their care if they feel comfortable asking those questions and they have a positive patient experience. If they don't, it just causes them to, like anybody, when we have a bad experience wherever we go, we tend to shut down and either not go back, and that's not what, we want. We need to really partner with our patients, and that positive patient experience is much more than, just word of mouth. It's really, it extends to their family, to maybe their children, to their parents. So it's critically important. That care should be respectful. It needs to be culturally appropriate, linguistically appropriate, and really be person-centered is what I like to say.
We measure as a company and our solution, interactive solution, we measure our success by how many patients are engaged in accessing their health, are activated and ultimately driving positive outcomes. But it's not a strategy to address low health literacy.
Health literacy is not a problem,
right,
and the technology is not a strategy. The interactive portals really give the opportunity, to provide customized or individualized, again, culturally and linguistically appropriate health literate information to patients or other healthcare consumers. It's an outpatient setting. What's important is that information, once it's up, oftentimes, and even in my past experience, sometimes once the information is placed live, people tend to think it's done and that's that. But there's so many opportunities to engage patients through that technology, whether it's a portal on the TV or if it's an iPad or any other kind of a kiosk, that is understandable and really helps those patients navigate and enhances their care.
You actually talked about in your book, Health Literacy in Nursing, that health literacy skills are actually evolving or changing. Is that what you mean by that? So, you may put information in a certain area accessible to a patient, whether it's on a in-room display or tablet, but it's always changing. So,
well, if it's not current, people will not be engaged. So I think the important aspect of that is in the design of it, there are certain health literacy principles that must be integrated with that technology. And not only will it enhance the patient experience, but hopefully it will advance and enhance engagement, which will impact upon outcomes and safety. So there are health literacy principles that can be applied to the content that's being placed, whether it's on a portal or a website, so that each person who's looking at that can connect to it and feel like it's speaking to them personally.
Yeah, that's really key. I mean, just having worked with you on several deployments, it's very difficult to engage patients in anything unless they can understand what they're seeing or reading, the downstream impact, the ripple effect, right, of medication adherence, ultimately patient outcomes and satisfaction is really tremendous. So, I mean, we see health literacy and patient experience, patient engagement going hand in hand. Yeah, so I think it's incredibly important. You talked a little bit about, we referenced the technology. Goes to really our next question was more of a statement, let's talk about the integration of health literacy and technology, specifically interactive patient systems, because we see that as a significant tool in helping health literacy and overcoming some of the challenges supporting the staff. How does that enhance the patient experience?
Well, and just, if you want to maybe talk a little about what that interactive patient system,
you mean to define what it actually is?
To be helpful.
Sure, yeah.
Everyone can understand.
Sure. So I think the easiest way to think of an interactive patient system, formally called patient education or entertainment system, is it's very simple. It's really a technology that allows patients, family, and staff to interact. So it's not one-way communication, it's bidirectional. So patients, family members can interact with their care plan, get education, get entertainment, get information that's important to them. And like you said, we can talk a lot about the different options so we can customize it to their language and their cultural background. But it enables them to interact in a way that's not possible by just looking at a TV screen or a tablet screen. But what's most important is you're getting feedback from the system, and that feedback is data, and that data helps the hospitals, the care team, the health literacy experts improve the process. So what's working, what's not working. So that's why we talk about interactive technology as really a support mechanism for staff and health literacy initiatives.
Well, and I think, by integrating the health literacy with that technology, again, and pushing that information out to patients, hopefully engaging them in their care, not as a replacement for having the conversations. We still need to have the conversations. We still need to, speak to patients, everybody, in plain language, which is, everyday terms. It's not dumbing down information, which is what some people have shared. And then incorporating teach-back, which is a strategy that helps the person providing the information get a sense of if the patient truly understood.
Sure.
Not understood it, as a quiz.
Right.
Maybe I, as a professional, didn't do a very good job in presenting the information. So I would ask, for the person to tell me maybe how are you going to take that medication, how are you going to tell your wife when you go home, your new medication schedule, so it doesn't feel like a quiz. I'll know very quickly whether the person had a sense of the change, in their regimen. It doesn't necessarily mean that they're going to do that, but it's the first step, because many times we say, do you have any questions? Mm-hmm. And the patient will just nod their head. No, because they want to get home. They want to leave. They have other things on their mind. Or culturally, it's not appropriate. They don't feel comfortable, asking a question of a professional. So I think, by utilizing the plain language, by incorporating teach-back, asking things like, what questions do you have for me, almost encourages questions. And then after that patient education that hopefully is culturally appropriate, in the language of the person that's reviewing it, then engaging and asking questions about what they have read or what they viewed as a video or based on the feedback that we get and the data. So, it really can not only enhance the experience, because people learn in different ways. Sometimes they want to watch a video. It needs to be reviewed, through conversation, and then hopefully there's some written materials that can supplement it. And that's the best case scenario, is educating in a variety of ways.
For the family members that's sitting there as well.
But again, it needs to speak to them, as I say. It needs to be in the language that's very important. And I know sometimes that can be a challenge with the technology, is, having, with all the languages that are spoken now across the United States, it's a challenge to be able to provide that information on a portal or on a kiosk for wayfinding, when it's printing out the map for the department that you need to go to, in many different languages. But it's critically important if we expect to really have active partners, in our care.
No, absolutely. I mean, when we talk about patient engagement solutions, it's common to talk about the pieces, health literacy, the education, the technology itself, the hardware, but we really look at it as a total solution. You can't separate them. They all work together to support really the nurses and caregivers, right? It lets them have a deeper conversation with the patients when a lot of these other things are enabling patients on their own to do things, to take a little more control of the process while they're in the hospital. So a lot of these different technologies, some specific things just, so people can get their mind around what the technology and the solution can do. This customization of you call it portal, we call it user interface. Same thing, but basically the way a patient would navigate a screen, pick it, albeit a tablet or TV screen, that customization can be done down to the patient level, not just by facility or even service line. It can be customized by patient. So we talked about this in pediatrics. You see it a lot, where to engage children, different age groups, 0 to 4, 5 to 10, and then teenagers, the look, the feel, the way we engage with those children have to be different by age group.
Sure. I mean, and so different. Compare that to someone who's, 65 or 70
Absolutely.
years old, sitting there trying to use what you refer to in your business as the pillow speaker, or, and navigate through the channels or the menu that's up there. It's challenging.
It's very difficult, and it's a key piece in the initial conversations with the hospital teams and advocates to understand what the patient population looks like, because if you're not creating a compelling experience, you're not going to get them engaged. Certainly if you don't have good health literacy built into that, engagement is going to be difficult. We talked about the data as well, so getting real-time feedback, right? So being able to not only present questions as forms of text, but also using imagery. I think you mentioned that as well, how important visuals and that also meet health literacy guidelines. That's very important, having those visuals to help tell a story or to create some context so those patients can relate with that and then engage.
And sometimes the visuals actually can be just as important, certainly, but more important, because if there's a lot of, in something that may not be designed well, and there's a lot of text on a page or on a screen, it's overwhelming to a person. So sometimes the visuals really, are very important, and we have to be very careful about the selection of the visual, where it's placed, the formatting. It's not just the words and the pictures, but it's also the formatting of that content. And a very important part is, having the audience that's going to be using the information, or members of the community, if it's, a hospital setting or a clinic or acute care setting, be part of that process. To give that feedback, to say, I didn't, and watch and see how they use it and how they experience that session. You'll get very valuable feedback, and it's very important. If, you want people to be engaged and you want your information to be utilized, you want patients to be educated. It can help with not just patient education, but the general information about your organization, which is so important, the mission and vision, why we're all here doing what we do, service recovery. When you talk about the data that you're getting back, we could, assist the staff with the service recovery before they are discharged, will be made aware of it, can provide a solution to it before they go home. So when they get their surveys, hopefully, that will reflect the service recovery that was done.
Well, these features or applications and technology that wasn't around, several years ago, make all that possible, right? So now you're able to help those conversations. Like a patient wouldn't even know what to expect, what their schedule is going to be, what specific videos they need to watch. They'd have to ask for it. They'd have to obviously be able to speak with it.
They don't ask for it.
They don't ask for it, and we know that the staff is so oversubscribed with the different priorities and requirements now, so it's hard for them to always adapt to the patient requirements. So a lot of that technology can drive or automate some of that information to the patients. So again, you have deeper conversations with the staff.
And we're talking about portals but think of all the other. I mean, it's something as I do consulting. It's almost you see everything. So look at the digital screens or the digital signage that's maybe in waiting rooms. You've got a captured audience, family members, are sitting there. What does that digital signage look like? Is that consistent? The language that's used, the terms that are used, is it consistent throughout the organization? What about the kiosks in the lobbies for wayfinding? Many of us, you ask for directions. It's very confusing. I mean, think of how, I always say, I might have some education, but I cannot find my way out of a paper bag. My sense of direction. So I'm one of those people who likes to have something written down. I listen very intently to the, instructions. And, I go down the hall, I make the first turn, I make the second turn, and then I'm like, what did they say? I can't remember. So having those kiosks and in the different languages have the maps print out is very important. And helps with that wayfinding. Parking garages, the signage that's up there, I mean, it all should be part of the plan, the strategic plan of the organization, and it will support the mission of the organization, and it will support the patient experience. And then, static signage as well, which, I know we're not talking about, but the terms that are used on the signs for wayfinding need to be the same terms that we're using on the portals and in the technology, and so often there's a disconnect there. So it's really taking that step back, looking at the broader picture. It's not just a TV in a room. It's just not a TV for entertainment in a waiting area. It's much more, and I don't think always that each organization is always using it to its full potential. So I think those are just important. And telehealth, I mean, we didn't even talk about that. So where we're going with that in the future. So it's very important.
Video translation services.
Exactly.
So we do that in some of the hospitals where, again, if language is a barrier, you have access to people who can translate and speak your language. So there's a lot that technology can assist with. It's not the strategy for health literacy, but it's definitely, I think, part of the solution. So, we talked a little bit about the technology and integration with health literacy. One of the questions that everybody asks is, how do you get started? Where's that starting point? And we can talk about it from your perspective, again, as a former nurse and a health literacy expert, always a nurse.
Always a nurse.
We can talk about it from a technology provider perspective, but I'll let you go first.
So, I mean, that's a good question. How do you get started? Well, I wish I could rattle off, three main things, and that would be the plan for every organization. One approach, let me say that, one approach does not necessarily fit everybody. But in my consulting, I think what's very important is that first, I always begin with aligning and supporting the mission of the organization. And, the missions vary from organization to organization. So having a sense of the culture of that organization, their mission, and that has to be supported by, at the same time, having the right people in the room. So this is not just, and I don't mean not just, it's not just entertainment, it's not just patient experience. It's so much more than that. It's about providing respectful, culturally appropriate, linguistically appropriate care because it makes a difference for patient outcomes. and patient safety. So it's very important. So having the right people in the room right out of the gate helps align with the strategies and the initiatives that the organization is working on. So, having that CNO in the room or your quality or risk management person, patient experience officer or a patient experience team or, IT, they need to be part of that. But sometimes they're the only people in the room, and they need to be there, but they need to be supported by the clinical staff because it's that important. So I think that's a first, very important step.
How do you get all those people in a room?
Well, you do that. You tell me. It's a challenge, but I think getting a sense of the organization. My second point would be to do an organizational assessment, which might help with getting those people in the room. So, asking for data. Look at their community needs assessment. What populations do they serve? What are the top languages in their organization? What are the high-volume service lines in the organization? Again, what initiatives? So if you have the right people in the room, you can do that assessment, do a full assessment, and then take a look at all that data, survey data, how they're scoring and trending, and then that will help you develop that strategic plan for implementing, the interactive portals, but also sustaining them, so that once they go up live, staff just doesn't feel like, oh, we're done, and then they're on to the next thing. So I think that's one way to get the people in the room. If you're asking about that information, they'll have to have those people there to provide that information. And it's about aligning and partnering with them. And, I often say, if you had a magic wand, what's your first two, what would be your top two things that you would like us to, help you with? Or what areas are you struggling with? And maybe there'll be a solution through the interactive patient system, portal systems, but, maybe you could help with 2 out of the 3 and align with them. I think people just often think it's about entertainment.
Yeah, and even just that term, just entertainment, I mean, that's an enormous anxiety reliever for a lot of these patients. So even the right dose of entertainment is incredibly important in getting people engaged and increasing the patient experience, and even for health literacy. We talk about having gone live and, even just this year, many hospitals, over hundreds of clients. Just showing up is the first step. I mean, just making sure that they know they can rely on you as a partner, showing up to the meetings, doing lots of listening, asking good questions, but then taking it a step farther, because I do think there are a lot of demands on hospitals and nurses, so just listening isn't enough, and you have to guide as well. And I think showing what we've seen in the industry, working with people like yourself and other health systems where you can give examples of best practices, I think is very valuable for the health systems, but that helps you align. I think that's how you get alignment.
We're all there for the patient, right? I mean, that's the reason that we're all doing this. So I think aligning and trying to support each other and developing that partnership, I always say it's a journey. It's not a flavor of the month or, just an initiative that we're doing. It's right. It's a journey. And there need to be short and long-term goals, and, it needs to be milestones, and you can be agile. You can have a plan. It may need to change along the way based on organizational needs. New buildings go up, new service lines are rolled out, volume changes, initiatives change depending upon the state or, CMS, different initiatives. So being able to have that portal done in a health literate manner and then being able to adapt it to what the hospital, all the challenges that the staff and the hospitals are dealing with, I think is critical. The other thing is that the technology, my experience, it can, and correct me if I'm wrong, but it can provide, information in emergency situations, or it can be updated if something is occurring in the community. When we have hurricanes, and so I mean, it could be in addition to the relaxation content that's very useful to the patients. It can be used for many different modalities that people don't always think of. They think of entertainment. They hopefully think of patient education. But I think there's many things that we can utilize that for. New medical data or procedures, medication I mean,
their schedule.
The whiteboard. So I think that first meeting, with the right people in the room, looking at that data, having that collaborative conversation about short and long-term goals, and then setting that expectation that it's not one and done. It's a journey, and we're here with you, and we're going to, collaborate together and do the best that we can.
It's also a rally point as well. I mean, once, having seen many go-lives when the system is implemented in a room and there's sign-off and there's a group of stakeholders watching it go live, it always amazes me how excited people are to see their hard work literally up on every patient's screen. Even if it's just basic information to start with. I mean, it's really exciting to see that.
It is. You want to maintain that excitement, as it's up 3 weeks, 4 weeks later, 4 months later. So that's why I think those beginning steps when we're getting started is so key, to have those right people in the room. Otherwise, it tends to go live, in my experience, and then the excitement kind of fades.
Well, that's the challenge with any technology is that unless you get the technology rooted into the operations of the health system, getting it used, keeping it fresh, it does become just an event, and then eventually becomes, an old, outdated system process that people, feel like they've invested a lot in, but could have maximized more. I think that's part of the process as well. It's an ongoing process.
Again, though, if that isn't developed in a health literate way, or it's not in the languages of the patients that are accessing it, they're not going to utilize it, and you won't have them they won't have a positive patient experience, and we won't enhance patient safety at all.
But it even goes beyond, we'll call it, the technology provider healthcare system. I know when we worked with you, this was about qualifying content partners as well, and other providers of different types of information that helped build the solution to get them adopting some health literacy standards, right, or practices.
Oh yes,
that was
it's a big responsibility. You're putting information up there that people hopefully are looking at and becoming educated and going to go home and implement some of the things that we're asking them to do. So it's critical that information is evidence-based, and that it's up to date, current, and evidence-based, and that the professionals that are the nurses or the physicians that are pushing that information to the patients have that level of comfort that is the case. Or if they're unsure of the content, they could easily access that evidence to say, oh, yes, this came from, whichever credible organization or the guidelines. So that's critically important.
Well, that brings us to our last question, and then we'll have time to take questions from the audience. So who should support this?
Well,
from the organization?
I think, we touched a little on it. I mean, it's not an isolated initiative. So I think senior leadership needs to support it out of the gate. I'm not saying they need to be there in every, meeting 6 to 8 months later, but it needs to have that support of senior leadership, and certainly the, nursing, the chief nursing officer, hopefully the chief medical officer, if there's a risk or a quality person in the organization. And I think as you're developing the content and the formatting, members of your intended audience need to be part of that as well. I think that a patient experience officer can lead the project. Every organization has different resources. So it's part of that assessment is looking at the resources at that organization. You don't want people there that really don't need to be there. People's time is valuable. Everyone is extremely busy. But you need to look at the resources that they have and then incorporate the appropriate ones so that it's integrated across the organization. It's part of onboarding for new staff. It's as important as, many of the other initiatives that they're educated about in orientation. That should be part of it. And there should be a mechanism for staff. The reason why you need to have the correct people in the room is there needs to be a mechanism for the staff if there's a complaint or an issue with it, that there's a contact person that they can go to share that with. Otherwise, it becomes a burden to the staff, and then they lose that interest. They're dealing with a lot of very important, things throughout the day. It's very challenging. And some organizations, the staffing ratios are high. It's important stuff. It's life and death. So sometimes you might get that, and we've talked about that the staff just doesn't even, that they're not a proponent of it. And I think there's so many competing, I'm losing the word, but priorities. Sure. Thank you, that they're dealing with, and they're trying to get through the day. And their main concern is that patient. But I think if we have the right people in the room, we have that team supporting the effort, it's being integrated and aligned with their other organizational efforts like patient safety or falls or hand washing efforts or medication reconciliation or infection initiatives. It has a different look and feel to it than to the staff. And it actually will provide tools and strategies for them to assist with, educating patients and to completing those initiatives in a safe way.
We always look for that advocate. There's always really a single point of contact or one person that becomes the advocate and then brings together that team within the organization. And that advocate could be at any level in the organization, all the way up to, in some cases, the CEO is the champion of it.
No, and many times I often hear, it's nursing. And, what's that?
One more thing.
And it is nursing. Nursing is at the bedside, probably the most out of all the healthcare professionals. But you know what? There's a whole team of people that sometimes aren't being utilized to their full potential, and they want to be. So the gentleman or the woman that's, bringing their meals up or cleaning the floor, or making the beds, they're in those rooms every single day. Sometimes they know those patients better because they see them every day. Whereas many times nurses work 12-hour shifts. They might be there 2 days and they're off for a couple days, and now they have a new patient, so there's less continuity than there was years ago. So I think it's that team approach is really important, and if really the goal for me would be to change the culture of the organization to one that is a health literate culture. And all these things then, become the norm. And everybody on the team, no matter what their role, can, speak in plain language. All the information, whether it's written or up on a portal, is written in plain language and formatted in a correct way. And they use that universal, what I say, a universal precaution approach. But we never assume that somebody, understands everything that we say. We assume, in fact, that most people will have difficulty understanding medical information, so that we always use those tenets. And we provide that same safe level of care for everyone. The other thing that we didn't mention, really, and I was just came to my mind, is this really also supports some of the standards and the regulations that the organizations are dealing with. So I think there's just something that I just thought of now that it would probably be helpful. When you're having those initial meetings and you have the right people in the room, how can this technology support, Joint Commission, Department of Health, the class standards, different class than then your recognition,
KLAS,
not KLAS, CLAS, cultural and linguistic appropriate standards, which organizations need to do. So if this is done properly, with that health literacy lens, it really supports all of that as well.
Great. There's a bunch of questions I see that came in that really piggyback on this last question. So I'm going to jump ahead and go into the questions. So the first question was if you were speaking to a hospital that's just starting out. Again, we talked a little bit about this on their health literacy journey. What might you recommend they start with?
So I think first what I would need to do, again, is assess that, understand their mission and vision of the organization, what type of services they provide, who their patients, if it's an inpatient setting, or who, the people that they're serving, what is their makeup, so that we can make sure that whatever we're doing meets their needs. And then if I had to pick one thing that every organization, regardless of that, I think that universal precaution approach would be something that, if I must pick one thing, would be something that everybody should do. A healthcare setting is not the place for a reading test, to find out what grade level you're reading at so that we know what resources you need. If we, speaking in plain language or designing a portal in a health literate manner or writing information or signage in plain language is good for everybody. So there's no downside. So if I had to pick one, despite, all the things I had mentioned, that would be one. I have to pick one, yeah. That would be it.
Great, thanks. The next question sounds like it's aimed at me or TVR. So does the PCARE system allow for patients to use their personal devices to access educational programs? The short answer is yes. The way in which healthcare systems really allow us to do it is in process. So the system itself, the PCARE system, is built on a platform that allows for information to go wherever the patient goes, whether it's in the patient room on a TV, on a tablet, or ultimately on their mobile device. There are security restrictions in how much information they can access while they're in the hospital on their tablet or on their own personal device. But when we look at education specifically and workflow, we want to direct that content to go wherever the patient and however the patient is accessing that information when they leave. So I'll give you an example. Many hospitals are looking to leverage the workflow that their EHR, their medical system, electronic medical system, has in place. So when a patient leaves a facility, we want to send that information to, you pick if it's MyChart or if it's a Cerner installation. We want to send that information back to the EHR portal where the hospital and the patients are all going as their central repository for information after discharge. So we'll send our information back into the medical record, which the patient then can access on their mobile device or at home or whichever medium that they're using to access it. So I'm going to say yes, there are some challenges with patients being able to get certain information and PHI on their mobile devices. There's security clearances that hospitals have to deal with. So with respect to bringing your device right now and getting all the information on your mobile device, your own personal mobile device, we can do it as a company, but the healthcare systems generally have some restrictions on that. So it is case by case with respect to your specific device. Hope that answers the question. The next question is about videos, patient education content. So again, we alluded to this earlier. There's a lot of content out there, a lot of content companies.
Personally,
how do you pick the best?
Speaking, what I tend to do, like I said, it's a very important component that we're putting up there, and we're giving that to the patient. So first of all, I would want to assess that they have content that provides the resources for the service lines that we're caring for in an organization. So if a company has tremendous cardiac videos but not orthopedics and you're an orthopedic institute, it's not going to help you, obviously. So you need to look at their catalog, so to speak, or their library of resources that they have. Then once you do that, I mean, it needs to really, again, meet the needs of the population that you're serving. So, looking at them, see if they're culturally and linguistically in alignment with the population that you serve. Are their guidelines evidence-based? So, if they're telling people in the patient education, often, there's instructions that are given to patients for that certain diagnosis or that surgical procedure. So are those instructions evidence-based? Is that information evidence-based? And then I ask, how do you develop your content? What are the health literacy principles? And you get a variety of answers. It's it's challenging and it's cost prohibitive. It's difficult to do, but it is possible. So I would ask, lastly, what are the health literacy principles that are applied when you're developing that content? Who's part of that development team? How often is it reviewed? What's the feedback that you've gotten, and who are some people that you can recommend? And then I've called, those organizations and speak to the staff as well.
So it's a lot of work up front to qualify best-in-class content that meets health literacy guidelines. But would you say that if you're deploying over a large health system, multiple facilities, once you qualify those partners, it does make it easier for the rollout after that?
Yes, it does.
You're going to have to go back every single time.
Yes, because then, you think of it from the patient perspective and the family. A patient may not always end up in that same institution, but, maybe in an ambulatory setting that's part of that health system, or in a clinic, or, depending upon what they're seeking care for. So wouldn't that be wonderful that even if they're part of a large system, that every service that they, utilize is all this consistency, not just in the content, of course, but also in the look and the feel and, everything about it is a reflection of that entire organization. Obviously there are things that need to be individualized and should be for the individual organizations in a system-type setting, but, there needs to be some consistency along that continuum of care, whether it's prevention, or inpatient, or ambulatory setting.
Agreed. Well, thank you. We're coming up on the hour, so that's all the questions that I see here, and we really have time for. However, I will provide the contact information for Dr. Parnell as well as TVR. If you have specific questions or you'd like to know more about health literacy or T-Care interactive patient systems, please feel free to reach out. Thank you so much for your time today.
Thank you for having me.
I really enjoyed that. Okay. Thank you very much, everybody. Have a great day.
Thank you.
Thank you so much, Frank and Dr. Parnell. I just want to remind everybody before we go today that we will be emailing you a link to today's recording. So with that ends today's webinar. Thank you, and have a great day, everyone.